Well, John, looks like you made it through the surgery like a champ. How are you feeling?
Like I got run over by a truck. Is that normal?
It's pretty normal after surgery. That's the anesthesia wearing off. The truck will back off slowly, I promise.
I'm holding you to that, Amy. If the truck sticks around, I'm filing a complaint.
I'll make sure to pass that along to the anesthesia team. But on a serious note, are you in a lot of pain right now, or just feeling sore?
It's more soreness than actual pain, but my head feels cloudy, like I'm half awake, half dreaming.
That's the anesthesia and the pain meds talking. It'll clear up soon, but don't be surprised if you feel like you're in a bit of a fog for the rest of the day. Just rest up. Your body's been through a lot.
Yeah, I bet. How long was I out?
About 3 hours. The surgery itself went smoothly, just as planned. The doctor will stop by later to give you all the details.
3 hours? Felt like I was asleep for 5 minutes. Not that I'm complaining.
That's the beauty of anesthesia. It does that. 1 minute you're counting backward from 10, and the next thing you know, you're waking up and it's all over.
Yeah, I don't even remember making it past 8. Guess I wasn't very good at that counting thing.
Don't worry, it's not a math test. You did just fine.
So, what's the next step? How long until I'm out of here?
Well, the next step is recovery. For today, you'll stay here in this bed, resting. We'll keep an eye on your vitals, make sure you're comfortable, and manage the pain. The doctor will assess you tomorrow morning, and then we'll talk about when you can go home. Maybe a few days, depending on how you're healing.
Yeah, I'm just eager to get out of here. Hospitals aren't exactly my favorite place.
Trust me, I hear that a lot, but I'll do my best to make it a little more bearable. Got any special requests? Extra jello, a better pillow, some cheesy hospital TV?
Now that you mention it, Jell-O doesn't sound too bad, as long as it's not that neon green kind.
Noted. No neon green jello for John. We'll aim for the red stuff. It's classic.
Now we're talking. You're a real lifesaver, Amy.
Just doing my job. Speaking of which, I'll need to check your incision in a bit. But don't worry, I'll be gentle.
Great. Just what I wanted, someone poking at my stitches.
I promise, I'll be quick. It's important to make sure everything's healing as it should.
Yeah, I get it. I just never thought I'd be the guy lying in a hospital bed, counting stitches and waiting for red Jell-O.
It's funny, isn't it? Life has a way of throwing curveballs when you least expect them.
Tell me about it. One day I'm fine, then boom, I'm told I need surgery. Just like that, everything changes.
You're not alone in feeling like that. A lot of people struggle when their health takes an unexpected turn. But the good news is, you're on the road to recovery now.
Yeah, I guess. I just don't like feeling helpless, you know? I'm used to being in control, handling things on my own.
I get it. It's tough to let go, especially when you're used to being independent. But healing takes time, and sometimes the best thing you can do is let others take care of you.
I suppose. It's just strange. Like, I have to rely on you for even the simplest things right now. It feels weird.
There's nothing wrong with needing help, John. Everyone goes through it at some point. And hey, that's why I'm here. To make sure you're okay, and to help you get back on your feet.
You're good at this, you know, making people feel better.
I've had a bit of practice. It's my job to make sure patients feel supported, even when they're not feeling their best. And honestly, I enjoy it.
That's good to hear. It must be tough sometimes, though, dealing with people who are in pain or scared.
It can be, but it's also rewarding. Every day is different, and I get to meet people like you, people who are going through something challenging, but coming out stronger on the other side. It's inspiring, really.
Never thought about it like that. I guess I'm just trying to take things one day at a time.
That's exactly what you should do. One day at a time, one step at a time. Before you know it, you'll be back to your old self, complaining about traffic instead of stitches.
Sounds like a dream. Honestly, though, thanks. You've made this whole thing a little less scary.
That's what I'm here for. And remember, you're doing great. The hard part's over. Now it's just about healing and letting your body recover.
Yeah, I guess I can handle that, as long as there's red jello involved.
I'll make sure of it. Now, try to get some rest. I'll be back to check on you in a little while. But for now, just relax. You've earned it.
Thanks, Amy. I appreciate it.
You're welcome, John. Rest up.